Hi there everyone. We will be studying about tennis elbow in this video. But before that, if you are new to our channel, please hit that subscribe button. Click on that bell icon for the notification of the latest videos. Let's get started. Tennis elbow is clinically known as lateral epicondylitis because the pain occurs at the outer part of the elbow. Usually, the forearm muscles are affected in this condition. There is another condition when the pain or tenderness occurs at the medial epicondyle and which is known as medial epicondylitis, commonly known as golfer's elbow, also seen in baseball players. Tennis elbow is a condition where the inflammation of the tendons of wrist extensors occurs. The extensors of wrist joint are attached on the lateral side of your elbow. Due to overuse of these muscles, they become sore from excessive strain. Let's draw the diagram of human arm showing the outer part of the elbow. Let's see the attachment of the wrist extensors and location of discomfort and pain. When we talk about this condition in tennis players, specifically, the improper backhand stroke is the culprit. So here is the lower part of the humerus and the forearm muscles attached on the lateral side, which are the wrist extensors. This yellow part is the area which is commonly affected and painful. This area is the common extensors origin of the wrist joint. This is the point at which the symptoms of the tennis elbow starts. Usually you will notice an inflammation at this area. There is tenderness, pain and burning sensation. The muscle which is usually affected in tennis elbow is the ECRB, extensor carpi radialis brevis. Now let's move on to the causes or occurrence of this condition. This occurs usually due to overuse of extensor tendon or overuse injury. Tennis elbow is a chronic condition occurring over a period of time. You can remember O2, occurrence and overuse. This can also be called as mechanism of injury. Let's move on to the pathology of the disease. Most commonly, the tendon is affected. Tendon is a part which connects muscle to bone. But sometimes, along with the tendon of wrist extensors, the annular ligament around the radial head is also affected. So, there is inflammation in the annular ligament as well as in the tendon of the wrist extensors. Let's see the age group affected. People older than 35 years of age are usually affected. Let's see the activities which put strain on this tendon. So repetitive twisting and squeezing motion involves the wrist extensors. Moving on to the occupation, housewives. The activities of housewife involves extensive use of wrist extensors. Next come to the plumbers, meat cutters, musician, dentist, carpenters, computer workers, racket players. Basically, wrist extensors are involved in almost all activities of our daily living. Faulty techniques and weak musculature can cause the problem. Moving on to the chief complaints, the person having tennis elbow will complain of pain, tenderness, burning sensation on the outer part of the elbow, where the attachment of the common extensors is located. When the disease progresses, the pain moves from your elbow towards your wrist joint. And in most cases, the wrist also becomes painful. This will cause difficulty in gripping objects, doing fine movements such as holding pen, knife, lifting coffee mugs, and even the grip becomes weaker. Lifting heavy objects causes severe pain at the elbow joint. As I have told you, fine movements become difficult. For musicians and computer workers, working on keyboard and piano can become painful. Use of painting brushes can also be a difficult task. Tennis elbow is a self-limiting condition. That means it heals on its own as soon as the injury in the tendon is gone. The time of tennis elbow is usually from 6 months to 2 years. There are several tests that can help in diagnosis of tennis elbow. The Mills test, Cozen test, certain MRIs, X-rays can also help in the diagnosis of this condition. Treatment can be conservative, very rarely requiring surgical procedure. Tennis elbow brace is given for the support to the injured muscle. Strengthening and stretching of the muscles can help. And that's all about the tennis elbow. See you next time. Bye-bye.